Hi everyone, I am Dr. Aadil Beigh, Consultant Intervention Nephrology, Apollo Hospital, New Delhi. I welcome you all to Avatar 2020. So today we are going to discuss about the hardware used in the cath lab. Now we are going to learn about the hardware of the used in the cath lab. This is the first thing. Imagine your patient is ready, it's draped, there's a site is prepared. Now we have to cannulate the vessel. It can be femoral, it can be the radial. So the approach, or it may be the fistula. So this is the micropuncture needle set. So the micropuncture needle set is a radial one. So micropuncture needle set contains a micropuncture needle. It may be the 18 gauge for the femoral or the 22 gauge for the radial. It contains a sheath with the side arm sheath and the valve sheath, and then the dilator and a small syringe. So imagine that your patient is ready for the cannulation, and imagine this is the femoral artery, this is the introducer needle, this is the 18 gauge introducer needle. So I will put the needle, I will cannulate under ultrasound guidance, I will cannulate the femoral artery or femoral vein. Then this is the guide wire. This is the J-tip guide wire, introducer guide wire. This is the short length around 30-40 centimeters, and this is the straightener. So I will straighten it so that it can accommodate into the needle. So I will put the guide wire. This guide wire is inside the vessel. I will remove the needle, check the guide wire in the vessel by fluoro. This all under fluoro, and I will prepare the sheath. This is the dilator of the sheath, and this is the sheath. So sheath has few parts. One, this is the open hollow sheath. It is a one valve, it's a cap and with the one valve, and second is a side arm with the double lumen outlet. This outlet and this outlet with the valve. So this is the 6 French sheath, it's green color. So this dilator, it has a click sound on it, it has a one serrated portion. So we'll put inside the sheath, the dilator inside the sheath, and we'll notice a sound. This is one sound. We can notice that it's fixed to the sheath. It will not remove like this now. Now I will put the sheath inside the vessel like a circular rotating movements, and then I will remove the dilator and the guide wire. Now the sheath is inside the vessel. I will flush it with the saline, check the flow, see the patency of this, and then put a heparin. Then with this we have secured the access. So the access is femoral with the 6 French sheath. Now imagine if the sheath is in the fistula or in the radial artery or in the femoral vein. So I have to take the angio of that vessel. So I can put the dye on through this port only and take the angio or take the fluoro of that area. But if I want to take the fluoro of the central vessels, for example, or my approach is from the femoral and I have to go to the brachial region. So from the femoral I will put, this sheath is very small, this is very is around 6 or 7 centimeters. So I will go through the help of something to the brachial region and scan this area. So that will be the guide wire. So this is the straightener. I'll put here and put the guide wire inside it. This is the guide wire, is the Terimo hydrophilic guide wire. Just now we'll learn about this. So this guide wire I will advance to the desired vessel. So for example, I have to go from the femoral through the inferior vena cava, right atrium to the superior vena cava, then the brachiocephalic, and for example the left side of the fistula in the left basilic vein, and through there to the cephalic vein of the forearm. So we'll learn about this. This is the Terimo guide wire exchange length. This can be 80 centimeter, this can be 240 centimeter, or 380 or 400 centimeter. We'll get the exchange length Terimo guide wire. This is the hydrophilic coating. The hydrophilic coating means that when we put it in the water or the saline, it becomes slippery. This is a hydrophobic. It allows water, so it becomes slippery. It can move easily in the vessels. So we have now put the guide wire to the desired tissue, and on the guide wire we can put the catheter. These are the catheters. This is the 5 French angiography catheter. This is the multi-purpose catheter, MPA, that is multi-purpose catheter. It has the catheter has its curves. So this is the primary curve, this is the secondary curve, and some has tertiary curve. Like this catheter, it has one, this is the primary curve, this is the secondary curve, and this is the tertiary curve. So they have 3 curves, 1, 2 and 3. It depends on the vessel, which catheter you are using. In intervention nephrology, we use multi-purpose catheters, because this is the straighter one, this is the diagnostic angio catheter. Now there is a guide wire. We'll advance on the guide wire the catheter, and we'll take an angio of that place. This is for central vein angio. This is for the angio of the fistula. We can take fistulography. We can go for the central venography. So if I want to take now for the patient, I found that there is a stenosis and I want to do the angioplasty. So for angioplasty we use balloon. So this balloon is 5 centimeter long and 5 mm in diameter. So this is the plastic sheet on it, and it is connected to this thing. There is rated burst pressure is 14 atmospheres. It's written here. So my inflation device will be attached here. So this balloon will be inflated. This is the inflation device, and this is for the guide wire. So I'll put the guide wire through this. It will be advanced on the guide wire. So guide wire, it is, if I want to do the angioplasty here, I will advance on the guide wire. I have put it on the place. Then I will attach the inflation device. First we'll discuss the inflation device. This is the inflation device. It is a valve and it has a meter. So how many atmospheres we are pushing. How it is used, this limb we have to put into the contrast, which is diluted with the saline. Press this one and then suck the saline in it. We can keep it in 10 or 15 ml. So now keep this is now negative, attach with the balloon, and then we can see the balloon. See the balloon. This is now inflated, so we can go 2, 3, 4, 7, 8, and we'll see the lesion. We'll see the stenotic lesion dilating. This is how we use the balloon. This is how we use the inflation device. So this is the 90 centimeter balloon, long limb with a 5 centimeter long balloon with a 5 mm diameter. And this is the inflation device. We have used it. So we can deflate the balloon and then remove it. Now at the end, we have done our job. We have done the angiography, we have done the angioplasty, we have removed all the hardware. Now we'll press on the skin and remove the sheath, and this has completed, and put the dressing, tight dressing on it, and this has completed our procedure of angiography or angioplasty. This was the hardware used in the